and welcome to part 2 of COVID-19 vaccine FAQs. I realized I was way less fun in part 1, partially because I was running on fumes, still am, and well, today it's just better because I finished a round of exams. Ding! So we're feeling good today. All right, let's go. If you're new here, join the club. My name is Marley. I'm a medical student, and I had a lot of questions about COVID-19 vaccines. It is a hot topic in med school, as you might imagine. I noticed that a lot of places had really good information, but that information was spread out all over the place. So here, I've condensed all that information into a more manageable, understandable format that has been helpful for me, and so I hope that it will be helpful for all of you watching as well.
And because this is such a sensitive topic for a lot of people, please know that I am not in any way sponsored, affiliated with, or endorsed by any of the companies that are talked about in this whole video.
And this is not medical advice. As I said, I'm a med student. I am a student doctor, and I'm relaying information to these frequently asked questions from reliable resources and reputable institutions. I will put links to all of my sources in the description box below, and while you're down there, do not forget to click the subscribe button and hit the notification alarm bell as well. And if there are any questions that you have that I missed, please let me know in the comments. And with that, let's get started. Let's go. Question 1. Yes, 100% yes. The reason being, due to the really severe health risks of getting COVID, like a nasty case, right? And the fact that reinfection with COVID-19 is possible. You should be vaccinated whether or not you've had a COVID-19 infection. Experts do not know how long someone has protection after getting COVID and making your own antibodies, your own protection from it, aka the natural immunity. We don't know how long natural immunity lasts. The CDC and others recommend this. You may consider waiting 90 days after getting infected, as it's not common to get COVID-19 again within 3 months of first being infected. So they're thinking at least 3 months and you're pretty safe, not gonna get reinfected with COVID. But a brand new study indicates that people who have been previously infected with COVID have high levels of antibodies for at least 6 months. Okay, cool. Now that's just one study. Don't take it at face value. There's gonna be a lot more coming out on this. Stay tuned. And the bottom line is, talk to your doctor, ask all the questions about whether or not you should be concerned about getting the COVID-19 vaccine. And if you don't know what I'm talking about, you're like, why would I be concerned? As of right now, there is a subset of people for whom it's not recommended to get the COVID-19 vaccines currently. And I explain the details of that in part 1, and I'll link that up above. All right, now on to question 2, let's go. No, CDC, everyone, no, you do not have to pay for the COVID-19 vaccine. Y'all, we already paid for this in taxpayer dollars through Project Warp Speed. If you're going to a place to get a COVID-19 vaccine and they're having you pay for it, be suspicious. Be suspicious. And I quote from the CDC here, vaccine doses purchased with US taxpayer dollars will be given to the American people at no cost. However, vaccination providers can charge an administration fee for giving someone the shot. That's it. If they're charging you for the actual shot, vaccination providers can be reimbursed for this by the patient's public or private insurance company, or for uninsured patients by the Health Resources and Services Administration's Provider Relief Fund. Wow, I'd say that 10 times fast. Holy Moses. No one can be denied a vaccine if they're unable to pay the vaccine administration fee. Good to know for us poor students out there. Y'all know who we are. All right, that was quick. Let's go on to question 3. So Cleveland Clinic actually has some good answers for this. Let's read. A common question that they get apparently is, do you have to pre-medicate to prevent allergies or fevers? The answer is no. When you're getting the COVID-19 vaccine, you do not have to pre-medicate. If you are scheduled to get your first dose, there are some precautions that you should take with any injection. For example, if you're taking blood thinners, you should tell your healthcare provider that you're going to be getting an injection so you can do what's necessary to avoid extra bleeding from the needle. So in general, review your medications and health conditions with your primary care physician to make sure that they are not going to interfere with your ability to get an injection. Pretty straightforward. Really don't need to do any clarification or interpretation on that, I don't think. All right, yep, sounds good. Next question. So, Cleveland Clinic again, coming in clutch. Here we go. While pregnant and breastfeeding women weren't included in the first COVID-19 vaccine trials, safety data is reassuring. Since the vaccines don't carry the live virus, this is something else we talked about in part 1 of COVID-19 vaccine FAQs. If you need the refresher, the link is above. Since the vaccines don't contain the live virus, they aren't thought to increase risk of infertility, miscarriage during the first or second trimester, stillbirth, or birth defects. There's also no evidence to suggest the vaccine is a risk to a breastfeeding baby. That said, getting the vaccine while trying to conceive during pregnancy or when you're breastfeeding is a personal choice. We encourage you to talk to your OBGYN to help you make a decision together. That's nice. Yes, do that. All right, next question. Short answer, generally, yes, you need both doses. Now, let's read about some of the caveats to this though. The CDC says both vaccines are given in 2 doses. It's important for you to get both doses of the COVID-19 vaccine to get the maximum about 95% protection benefit. Pfizer's vaccine doses are given 21 days apart. Moderna's vaccine doses are 28 days apart, but if you can't schedule your second dose during this time frame, you do not need to get the first dose again if the second dose is given later. This is because the CDC says there is no maximum time between doses. You don't need to go in on exactly the 21st day after or exactly the 28th day after. You have some flexibility as far as when you can get that second dose. That's great. The only time that you would want to skip the second dose would be if you had an allergic reaction to the first dose, or if you did get sick with COVID-19 and received an infusion of a monoclonal antibody drug due to being at high risk or having a chronic medical condition. If you're like, what the heck is a monoclonal antibody drug? Yeah, no, you'll know if you got one because it's a special class of drugs and you will have talked this over with your doctor if you're receiving one of these. So again, if you have any questions, if you're like, that sounds familiar, go ask your doctor. Make sure you're clear, ready to go for the vaccine and both doses of whichever one you get. Okay, now last question. Great question, great one to end on. Baylor Med has an answer. Let's read it. Studies of both the Moderna and Pfizer vaccines showed that protection from COVID-19 begins about 2 weeks after the first vaccine dose. You are not considered to be fully protected until about 1 to 2 weeks after the second vaccine dose. Pretty simple. Now, there's new data coming out on all of this stuff all the time. This is my best effort to compile answers from across the internet, and there will undoubtedly be more questions that come up as more vaccines are brought to market and as we get more data on the longevity of these vaccines. And that's it for part 2 of COVID-19 vaccine FAQs. And if you found this video helpful, leave a like and subscribe down below so that others can also have their questions answered. And don't forget that I have put the links to all of my resources in the description box. Again, thank you so much for watching and catch you next week.